yields. The chair now recognizes Mr. Tonko for his 5 minutes of questioning.
Thank you, Mr. Chair. It has been very concerning to watch this administration's relentless attacks on science and the abandonment of scientific integrity in our federal health agencies. Decisions about health care must be free of political interference and based on science, not extreme ideology. So, Dr. Havers, according to your testimony and other public statements, you resigned from CDC in large part due to what you perceived as its loss of scientific credibility. In what ways has Secretary Kennedy undermined CDC's scientific credibility, and what are the consequences of that for Americans' health?
Secretary Kennedy has undermined CDC's scientific credibility, in large part, as I've mentioned, by using CDC as a mouthpiece for the anti-vaccine movement. They're putting false information on CDC websites. They're curtailing communications coming out of CDC, and using vaccine policy meetings that used to have the highest standard of scientific rigor to now promote false information and calling into question the safety and efficacy of well-established vaccine recommendations. If state and local health partners are saying they can no longer trust CDC guidance, I think if we had another pandemic, CDC's ability to lead a coordinated federal response when we've lost the trust of the medical community, we've squashed scientific innovation and taken away tools that would be most useful for us in the next pandemic, including mRNA vaccines, and state and local health partners no longer trust us, we are not an ability, the US no longer has an ability to have an effective federal response, given what this administration has done.
Thank you. And Secretary Kennedy is destroying the guardrails once in place to ensure that health policies are justified by scientific evidence. For example, Secretary Kennedy announced a change in the COVID-19 vaccine schedule for children and pregnant people without any input from CDC subject matter experts. And at meetings of the Advisory Committee on Immunization Practices, Secretary Kennedy's handpicked members have made vaccine recommendations that would take vaccines away from millions of Americans, even though there is no science to support those given decisions. The Secretary was able to get away with these changes by undermining career experts at CDC and installing ideological allies to rubber stamp his agenda. So when Secretary Kennedy ignores career scientists and only listens to his own allies, what is the effect on CDC's credibility and scientific integrity?
I mean, it has been destroyed in a few short months. I loved working at CDC. The career that I had there was incredible because I was able to do nonpartisan work that was based in science and evidence. The fact that people like me are now saying you can no longer trust recommendations coming out of CDC is shocking. I never thought I would be in a position to say something like this. And the amount of damage that this administration has done to federal scientific and public health agencies and their reputation and their credibility across the country in multiple communities, including the medical community and the scientific community and around the globe, is really heartbreaking, honestly.
Well, we've not only seen Secretary Kennedy ignore experts, but we've also seen him retaliate against civil servants who challenge his anti-vaccine agenda. For example, he pushed President Trump to fire CDC Director Susan Manaras after she refused to sign off on ACIP's vaccine recommendations without first reviewing the evidence. And Jenna Norton, a program official at NIH, has been put on indefinite leave for speaking out against the administration's harms. So, Dr. Havers, what effect does Secretary Kennedy's retaliatory campaign against scientists have on the integrity of their work?
Well, I think the administration has driven out many high-level experts from this administration. People are resigning because I resigned because I did not want to be lending my scientific reputation to an agency that I no longer feel is using evidence and science to make policy. And I think that the loss of expertise at CDC, NIH, FDA, and the undercutting of science-based policy across the administration, I think, is having untold effects. We do not have the expertise at these agencies to lead us through another pandemic, for example.
Let me ask our other witnesses, do you agree that it is dangerous when administration officials retaliate against scientists who disagree with harmful policies? Start with Dr. Pannu. Just a simple yes or no.
Thank you for the question. I think that retaliation is challenging to be the recipient of.
Doctor?
I think in this domain, having science lead on the policy front is important.
Sir?
I think these are incredibly complex and multifaceted topics that have a lot of dynamics in them.
But as to the retaliatory aspect?
Well, I think in general, retaliation is not an effective tool.
Thank you, sir. With that, I yield back, Mr. Chair.
The gentleman yields.